As you know, hemorrhoids is a lifestyle disease. So normally the patients come to us with a higher grade because they treat themselves on their own, the earlier grades. Little bit of bleeding or pain, they self-treat themselves. So most of the times when the patient comes to us, it is normally grade 3. Grade 3 means the hemorrhoids have come out of the anal canal and the patient has to push it back into the anal, inside the rectum. And grade 4 is when the anal cushions are outside only and patient is unable to push them inside also. So any surgical procedure has to be initially managed medically. So medical is a part of the surgical procedure before and after the surgery also. So diet, lifestyle changes, medications like phlebotomics add up to it. Grade 3 can be treated medically if the patient is able to control his diet, has loose stools, but if the bleeding persists, he has to go in for surgery. Surgical, there are different types of surgeries. With the latest advances, very minimal invasive surgeries are present. So initially, when I learned it, it was plain hemorrhoidectomy, where we used to cut off the hemorrhoids which are there and suture it off. So the great disadvantage of this was pain, severely painful to the patient. So grade 3 hemorrhoids can be treated medically if the patient is able to control his diet, has loose stools, and there is no bleeding. But if the bleeding persists, the patient is losing a lot of blood, he is developing anemia, he has to undergo surgery. Grade 4 is always surgery. This is the last stage for hemorrhoids and the patient can't recover from this medically. So surgically, there are different types of surgery. When we learned initially, it was plain hemorrhoidectomy, which means just cutting off the hemorrhoids and suturing them. But the great disadvantage was pain. Patients literally had severe pain and used to curse why they got operated. So as doctors started investigating it to decrease the pain, newer surgeries came into picture. By 2000, stapler hemorrhoidectomy came into picture, where a separate machine was there which used to staple the anal cushions and cut off the supply and used to help the patients a lot. The pain had decreased a lot. But over years, they found that recurrences after this surgery was also on the higher side and complications were also there. So later on, laser came into picture. So the latest is laser hemorrhoidectomy, where we use laser machine to coagulate the vessels so that they slough off or decrease in size. Another surgery which is very much in vogue is arterial ligation. There is a specialized Doppler which is put into the anal canal which detects the hemorrhoidal arteries, and the surgeon is able to suture them precisely. If it is grade 4 hemorrhoids, which means they are hanging outside of the anal canal, which we usually inject hyaluronidase injection into the anal canal or into the pile mass so as to decrease the edema so that they can be pushed back into the anal canal. Surgical options are the only definitive cure for the hemorrhoids. Medical management can just control it for the time being. Eventually, the patient will end up with surgery if he has grade 3 or grade 4 hemorrhoids, because the hemorrhoids cannot revert back from grade 3 to grade 2. There is another surgery which is cheaper and equivalent to all the latest procedures which are there, like laser, stapler. It's called as hemorrhoidopexy, where we take sutures inside the rectum above the dentate line so that the pain is less and the procedure cure rates are as good as any other procedure. But patient has to understand that even after the surgery has been done, he has to maintain his lifestyle so that the recovery is good. It doesn't mean that after the surgery he can have everything of his food. He has to, and the stools have to be soft for at least 6 months so that recovery is better.